Thanks everybody for joining us today. And I just wanted to introduce Lance here from HR Service, and he'll go over how it works, how it would be beneficial to you and your groups, keeping everybody compliant, making sure they're not getting fined. And then if anybody has questions on pricing, we can touch on that too. So thank you, Lance, if you want to take it away.
Yeah, you bet. Great. Nice to meet with you folks. My name is Lance Nielson. I'll give you a background real quick on what I've done. In 1982, I became a professional magician and was doing magic shows and have been doing magic shows for the last 43 years. And magic was my passion and my forte, but I got my insurance license so that I could have a lot of work besides just doing magic. I didn't want magic to be the only thing that I depended upon, because I wanted to be a dad, and I have 5 kids, and I'm a very loyal dad. I follow my kids everywhere. So, but I started a company called Worksite Benefits and Insurance, and I was a broker for 35 years. And about 10 years ago, I sold out and got out of that part of it. And I know the guy that owns HR Service because he was the guy that I use for all of my compliance with my clients. And so I came to work for HR Service. It's a mile from my house. And I've been a consultant ever since. So I've got a background in exactly what you folks do. And I wanted to share with you guys today why HR Service is the group that you want to deal with when it comes to compliance, because we make it simple. And I'll show you how that works. You'll come into a dashboard, this compliance login dashboard, and this is what a broker would see. If you're a broker and you've gone through KAFL and you've gotten signed up, and now you want to know what's available to you. So we have the ability in this broker portal to be able to provide you with some very valuable tools. Part of it is, let's say you wanted to learn a little bit more about employee notices. Why is that something that every group needs to do, or they will be fined because it's an ERISA item? We're going to talk a lot about ERISA. And ERISA was established in 1974. Those are the laws that everybody that offers any health or welfare benefit to 2 or more employees is subject to. And it's the Department of Labor and Health and Human Services that carry out audits for ERISA. So it's important to know what ERISA is. It's important to know what is expected. And we're going to cover all of the bases for ERISA in our service. Okay. So you can go in here and you could watch a training video on why you need to have employee notices and how that works. RAP document. Maybe you've heard about an SPD RAP. What is it? What does it do? Maybe you've heard more about POPs and what they are. You already know what they are. But this is just going to give you some nice extra information to kind of get into the weeds a little bit on going to a customer, client, whatever, and being able to say, look, you need to make sure your ERISA house is in order, because if you don't and you get audited, the fines can be pretty substantial. And I'll give you an example. On the website at the Department of Labor, it says 75% of the groups that we audit have a violation. And of those 75%, 32% of those are fined over 10 grand. So it's happening. There's 1,800 more auditors that are auditing. And I'll give you one more live example. I was at Lahu in LA, and a guy named Robert Tobin, who's been a broker for 40 years, came out to me. He says, Lance, I've never had anybody audited in the last 30 some odd years, but since 2023, I've had 7 now that have been audited. And so there's more auditors. They're carrying out these audits, and you want to make sure that your clients understand this stuff. And so that's what we're going to jump into today, to talk about ERISA, how we can fix it, how we can make it simple and it not be expensive. Okay. So when you log into this broker portal, you have these tools and things that are available to you. Any of these things are available to you for free. Your total compensation statement that you need to give to your employer groups if you're making commission, There's agreements that we have in here. There's a document storage vault that you can use if you don't have your own. There's just several things that we can do for you. So with that said, I wanted to show you the broker portal. I'm going to log out. I'm going to log back in as a client now. So let's say that you've got a client that is interested in this and they want to be able to go in and do these ERISA items. Let's look at how they work. So there's a menu over here. This is the client portal. Let's jump into the employee notice generator as an example of how our system works. There are about 15 different notices that the Health and Human Services, Department of Labor, the IRS require through ERISA. Well, how does an employer know of those 15 what they're supposed to send out? And that's where it gets really confusing. And that's why this particular situation is the most fined and most penalized ERISA item of all of them. Because they either send all of them and they shouldn't, or they don't send any of them because they don't know, or they don't know what to send. So this is a simple document. It's a smart document. And all you're doing is answering about 13 or 14 questions. By the way you answer that question, it now knows the different employee notices that you need to send. You do, maybe you do need to send a Medicare Part D. Maybe they do have 50 or more, so you need to send an FMLA notice, or a COBRA, or a CHIP, or a HIPAA. It's all in here as you just go through these simple questions, answering and checking those boxes. Now, your client has access to this, but so do you as the broker. So it gives you a good ability to kind of oversee what your clients are doing and making sure that they get it done. I always loved a reason when I was in the business to have a reason to call my client. And if I'll show you a couple of things that you'll be able to see that will tell you where they're at so that you can make a call. Hey, John, how are you feeling about this? I have noticed that you're not doing any of this. Can I help you? Or can HR service do a demo for you or whatever? Okay. So you have the ability to oversee what your clients are doing in our system. Once you've answered these questions, let's say you get down here to this Medicare Part D program and you're just not sure what to put. At every page of our website down at the bottom, there's a toll-free number you can call, an email address that you can send to, or you can jump into a live chat over here. You can get one of our 7 ERISA coaches on the line to get the question answered so that you can get this out of your hair. I'm not kidding you. This might take you 10 minutes to do. Okay. And it is an ERISA item that if it's not done and you don't have it done and they come and audit you, you'll get fined. Then you can go in here and say, okay, I've answered all the questions. I want the documents to be sent. You can use our document storage vault. You can have it generated in English, Spanish, or both if you've got Spanish speaking employees. It could be included in our vault so that they have a place to come in and see these documents if either the broker or the client doesn't have an HRIS system that they can display stuff. You can use ours for free. It doesn't cost any extra. Then you can see that it's going to be sent to the company, and there's the email address that maybe there's 8 employee notices that ended up you need to send. That's where it's going to go. You can send it to the broker as well, or you can send it to both. And it's going to go to those 2 email addresses. And you have the ability to set that up right here in the company profile. It's the very first thing that any group would ever do is they would come in here and they'd set up their business information. And there's that email address that those things are going to go to. If they carry out the rest of this information, I'm going to show you an assessment tool that is really cool to where they can do a self-assessment of where they're at in ERISA. I'll show you how that works in just a minute. But that's how that works. They come into that company profile, they get that all set up, they come into the employee notices, they get into that generator, they answer the 13 or so questions, and now they can hit generate employee notices. And let's say that this company has 8 of those 13 that they need to distribute. All 8 will come in a PDF file all in one document, and it'll be sent to that person so that now the person who's in charge of their HR or whatever can distribute those notices. Okay. And that's how all of our documents work in our system. You set it up. It can be in English, Spanish, or both. Here's where it's going to go. Make sure it's going to the right place. Generate those notices. Okay. Now, if you've got a person that's not eligible yet for the benefits, you can come down here and generate the health exchange notice because maybe they're on a plan, and you can generate your health exchange notices here as well and get them this document until they're eligible, and then you can generate the notices and get it to them. Okay. So simple, easy, backup right here if there's a question, so that everybody's taken care of, everybody knows what's going on, and that item is taken care of. You can check off that employee notice list. Okay. Before I go on, I'll be happy to field questions. Don't hesitate to interrupt. If you'd like your question answered or whatever, do it. But I'm going to keep going on, okay? Let's look at this HIPAA toolkit for just a minute. Every company is subject to HIPAA. They need to guard or take care of personal information for their employees. And so we set this up to where every company, if they're blue collar, they're not a doctor or a dentist or somebody that deals in medical, there's these 6 steps that every company must take to be HIPAA compliant. First thing is they need to define an officer. They need to have the files that have personal health information under lock and key. And then they just follow these other steps. If they need forms for those steps, they're right here. They can just download them. They got it. They can take care of HIPAA right now. Okay. If they're a doctor or a dentist or somebody that deals in personal health information a lot, there's a lot more steps that they need to take, and we define it right here for them. And then every form that they would ever need is here as well. So if they want to download our forms, great. They're there for them. Download it. That helps them get a HIPAA statement or policy or whatever. Okay. And I like to point out HIPAA because there aren't very many platforms like ours that offer HIPAA. And I don't understand why, because it is audited by both Health and Human Services and the DOL. Okay. Okay. So let's move on to the WRAP document. This is the one that most people hear about. If you were to call a lawyer there in New York and ask him to do a WRAP document for you, you're going to be looking at about $3,000 for that lawyer to do that for you. In our service, it's not even a 16th of that cost. And all we're doing is having you follow a template. So you're just checking boxes, answering what they have, medical, dental, vision. That's why it's called a WRAP document. It takes all of the health and welfare benefits that the company's providing and wraps it into one document. So an SBD WRAP is what this is. And there's information in a WRAP document, in our WRAP document, that covers all of the bases so that if anybody were ever audited, everything that an employer needs to know or an employee needs to know is in here. Okay. So you follow this down. If you got lost, if there's something you don't understand, every page, there's that backup right there. So you can call them, get the help that you need, get this out of your hair. The WRAP document might take you 45 minutes. That's the biggest document. If you printed this baby out, it'd be about 45 pages. Now about 40 pages. So it's a big document. Now let's talk about managing the document. Let's say that you print this out in January and in June something changed. And you all know that by law, you have 90 days to notify the employees of any changes. So right next to the WRAP document, we put this SMM, or a summary of material modification. And what that does is it gives you a 1-page, be able to go in, hey, the dental plan changed, it's got a new deductible, or the copay had to be raised, or that company went kaput, we're putting in another one. You have to let them know that. So you'd use that SMM to be able to modify the WRAP so that you're not dealing with 40 pages, you're only dealing with 1. And now it's an addendum to the WRAP. And if you do that consistently, you only need to print out a wrap document every 5 years. So a trail of SMMs, we put it right next to the wrap so you can manage the wrap, get out of it quickly, get it done, get it to the employees, and move on. Okay. Now, let's go back into it for a second. Down here at the bottom, you'll notice that it says, here's the company, or here's who it's going to be sent to. It can be done in English, Spanish, like we spoke about. Could be in the document storage vault if you want, and then you generate it. Now, there isn't a reminder on the wrap document like there was on the employee notices. The employee notices, we can set up an internal message that 30 days prior to your next renewal, we'll send you an email to say, hey, you need to do your employee notices again. That one is due every single year, whether benefits change or not. You've got to send the employee notices out every year. Okay. But the wrap document, you don't if you've been doing your SMMs. I hope that makes sense. Okay. So we've talked about the employee notices. That's a ERISA mandate. HIPAA, ERISA mandate. Wrap document, that's ERISA. SMM, if you want to keep that wrap document up to date, that's mandated. And then the other document that's everybody that has 49 employees or less has to do, or if they have over 49, it doesn't matter. Everybody has to do this no matter what. Then there's the POP document. And let's clarify the POP really quickly. Premium only plan is what this particular POP document is. It's not the Section 125 plan if you've got an FSA, an HRA, HSAs, those kinds of things. That's a different discrimination testing situation that comes up. This premium only allows all employees to be able to run any of the premiums that they pay out of their pocket pre-tax. This document needs to be set up in order for it to be legal that they do that. So the POP document gets set up. There's about 7 or 8 questions. It's pretty simple. If your POP document isn't dated after 2014, you're outdated and you're going to get fined. In fact, if it's not dated past 2021, it's not up to date and you'll be fined because the verbiage for COVID changed everything in a POP document. So that is why I recommend that the client and you as the broker use a company like us so that you don't have to monitor Health and Human Services, the IRS, the DOL. If there's changes, we do it for you. And we go into the document itself and make the changes. We have 3 ERISA attorney firms that sign off on the verbiage that we use so that we know we're legal. And then that way you sleep at night, your client sleeps at night. You're not worried about, are my documents current? Am I going to get fined? We take care of that for you. And then like what I was telling Jennifer, we send out 2 emails a month. The first email is a legal alert that updates you on any federal changes and then more specific, any state specific changes. So if you're in New York, or if you've got clients in New Jersey, or if you've got clients around that area, maybe in Pennsylvania, whatever, we'll send out a legal alert every month that updates you on all of those cities, all those states, and the federal, so that you're current, you're up to date, you know what's going on. And we send out an HR bulletin. And in the HR bulletin, we'll just update you on best practices and things like that, so you can keep current with those things as well. We're going to talk about a handbook because we've got somebody in our group here today that was, looking at that and wanted to know more about it. And I'll tell you about that here in just a minute. But that's what we do on our ERISA e-solution program. So as you look at this drop down right here, everything that you need for ERISA is in this ERISA e-solution package if you're 49 employees or less. Now there's 2 extra steps for the bigger players. So if you're considered an ALE, an applicable large employer, you have 50 full-time or 50 full-time and part-time equivalents. And now you hit another stage in ERISA, which is the ACA reporting. The ACA reporting is the 1095 forms and the 1094 form that goes to the IRS. We have a full service ACA team here at HR Service. Okay, so we can do that filing for you if you would like. I'm your contact for stuff like that. There's an ACA intake form I'd send to you. You guys would fill that out for either a company, or the company can fill it out and send it to me. And then that way I can provide a proposal to say, here's what it would cost if you have HR Service do this work for you. So there's one extra step of ERISA. And now the other extra step is if you're 100 or more, so a large employer. If you have 100 or more that participate in any benefit, starting the first of the year in your enrollment. So if you do January 1 to December, if January 1, you have 100 or more employees that participate in any one benefit. So maybe there's 100 in dental, maybe there's only 50 in health. That dental plan needs to be what we call reported. A 5,500 report would go out for that. And any other benefit that you've got 100 or more enrolled. That's an extra step. It's an extra cost. And our ERISA program covers the basics, but it doesn't cover those two plans, the ACA and the 5,500. That would be quoted separately. It comes through me. I put a proposal together, get it to you. Okay. So all in all, those are all of the services provided in the ERISA e-solution. And one last thing I'll show you. Once you've generated your POP document, so you've gone down here, you've answered your questions, you see where it's going, you click generate document, that POP document will come to the HR person that's going to hold on to it. This does not need to be distributed to your employees. The POP just sits in a file. If you're ever audited, you've got it on hand. Because it's assumed that if you have a POP document set up, then all your employees will participate. You don't have to have them sign on and say, yeah, I want to participate. And why wouldn't anybody want to participate in a POP plan? It's going to save them 30% in taxes. It's going to save the payroll group payroll taxes. So it's a win-win for both. Okay. The last thing that's going to happen is once you generate that POP document, now this discrimination testing software is going to appear. Okay. So for 2025, you do your non-discrimination testing in December. It's a look back. And you just plop into this little field here. It's a Excel spreadsheet. There's 3 folders. Let me pull it up for you so you can see it. And most of the services that are like ours do not do this. Come on, baby. It's thinking. It's trying. There we go. First file is going to introduce you to what's going to be done, who needs to participate, who does not need to participate. Just gives you the overall why you have to do this every year. And really all it is it's making sure that the company doesn't discriminate against the rank and file employee. It's not just offered to the higher ups or the supervisors or whatever, that everybody can participate. There's a census where the names would go. And then here's the question. Do you make more? Are you compensated more than $155,000 a year? Yes or no? That's really all they're asking. And then once that's all, you can just cut and paste, get in there, answer the question. Then you can see the test results. You only need to pass one of the safe harbors. So there's the 3 safe harbors. If you pass one of them, then you're compliant and you don't have to worry about it. Okay. So believe it or not, every company in America, if they're running premiums pre-tax, better do the non-discrimination testing or they'll get fined if they're ever audited. Okay. So, man, that's a lot of talking and a lot of garbage. I hope that makes sense. Are there any questions? Is there anything that I've gone over that you're like, what in the heck? I know I put Mike right to sleep, but I'm just making sure that anybody else. I just want to make sure that if you have any questions, don't hesitate. And, if something comes up later on today, don't hesitate to email me, guys, or try to call me. Happy to help you. But I just wanted to make sure that you can see how simple this is. It's simple. Plus, we give you the backup so that if you have to make a call, that coach can answer it and get you on your way. Okay. So that's the ERISA E solution. If a client were to buy that package, or if you wanted to provide this for your employer group, and let's say you got a pretty good group that you're working with, maybe they got 40 employees, you're getting a pretty good commission, and you would like to provide this for them, it's $20 a month. It's $20 a month, and you can actually go in and help them if you want to. And I'll show you how to do that in just a second. So $20 a month, that buys our ERISA E solution, $240 a year for the broker. If you wanted to charge your client for it, I'm telling you, they could call an attorney. And like I said, the wrap document alone in New York, it's $3,000. So you're saving them a bunch of money. And if you want to, charge them $500 or whatever, do it. $1,000, it's your call. You can provide these services for the client, and they'll be happy because it's not anywhere near as expensive as if somebody else like that did it. And I'll give you a couple of accolades about HR service so you feel comfortable. We are what's called a certified preferred provider for the UBA, the United Benefits Advisory. It took 3 years to get that certification. We sat through several ERISA attorney firms and their questions. They looked at our documents. They literally took our documents down to the Department of Labor to make sure that they would pass. And we passed. So now the UBA recommends us to anybody that's a part of the UBA association, United Benefits Advisory. That took 3 years to get, and it was pretty hairy as far as getting that certification. So we're accredited. We deal in all 50 states, including Hawaii and Alaska and wherever else. We're there. We're in Costa Rica. There's just several things that we can do with our compliance, and everything that we do is state driven so that you can feel comfortable that if you were to do our document, we've got the verbiage and things in there for New York, New Jersey, wherever you're at. Okay. Now, since there aren't any questions, I'm going to do something really quick here. I wanted to go back in as a broker, and I wanted to show you how you access documents so that if you wanted to sign up one of your groups and you wanted to provide that little extra, that little extra service, you can. So here's the dashboard for the broker. This is what you'd come into. Here's your client list. Okay. Alphabetically, you can see everybody that's in the system that you've loaded in. So let's look at this Lance Nielson insurance character. Look, he signed up in 2016, but there hasn't really been a whole lot that he's done. And you can go into the forms right here and see. Well, I guess that one isn't going to show it. So yeah, here you go. So we're going to use this Lawrence Equipment Sales. If you wanted to jump into their employee notices, you're in it right now. And if you've got the HR director on the phone and you wanted to go through these questions with them to help them, you can. You can hold their hand. If you want our staff to do it, they can just call that toll-free number and we'll hold their hand. So the idea is that there's support, but it makes you look good that you're involved, that you're helping them. Because if something were to go wrong, let's say that this doesn't happen. Let's say that they get audited. Who do you think they're going to point a finger at for not advising them of this kind of stuff? They're going to point the finger at you because the bigger brokers, they're out there providing these kinds of services for their clients. It's one of their caveats to keep them as part of their business. You ought to look at this as that kind of a tool that will help you keep and actually earn business. I was in Minnesota, and it was a GA that asked a question to 100 brokers that were in this meeting, and he said, "How many of you here, out of you 100 people, use compliance as a way to prospect and get new business?" And 3 brokers raised their hand, and all 3 of those brokers were using our assessment tools and our product, and they were taking business from the other 97 that were in there. Compliance is a big deal. And compliance can help you earn and win clients. And I'll show you how to do a little assessment here in just a second. But that's important. And use compliance for those kinds of things. So you can jump into your client's documents just by hitting your client list. You can see what's loaded in for them. All of those documents are there. So the wrap document, there's the premium only plan. You can jump into all of that. Okay. Now, let's look at the assessment for a second. What we're trying to do is make this available for you to be able to prospect with. If you found somebody and you were actually to ask them, "Hey, does your broker help you with your compliance? Does your broker provide any assistance in your compliance?" And if the guy says, "I don't even know what you're talking about," you got a live lead right on your hand right now. Well, let me show you what we can do. We can do an assessment to see where your company is at. So you would just go through here. There's a training video that you can watch so that you can send this out to a prospect. But they're going to go through here and they're going to put in their information about their company. They got 25 on their medical plan. Yes, we're just checking boxes. And we're going to say it's an LLC. Now, probably missed something. What did I miss? Yes. Okay. All right. Now there's asking questions. There's about 25 questions here. We're just going to go down here and mark it as if that's what we're, yes, no, all those different things. So it's asking them compliance questions, you guys. Do they provide this? Do they do this? Do they provide the employee notices? What notices are they providing? So on and so forth. Through this whole little compliance sheet here. Boom, boom. So this is Mr. Joe, CEO, or the prospect that you found at the company. They're checking these boxes, filling this out, doing this because they want to know where they're at. They want to see what kind of a compliance risk they're running. And we're just about there pretty quick. Boom, boom. No, yes. We're done. It's going to come back to you. You're going to be able to put together a nice little report that our system does for you to say, "Ooh, man, you got a 36% risk. There's some problems here. Here's your biggest risks, and here's what you need to fix." And it lists it for them so they can see what they need to fix. And in their screen, there's going to be a box that they can check. Once they get this HIPAA training thing done, they can click the box. It'll now drop that percentage point down to about 34%, and that item's been checked off. So this gives them a way to become completely compliant using this tool and giving you a big star on your head because you're in there trying to do something for this group where the other broker might not have been. That's the idea. Okay, so it's a great assessment tool that we put together to make it so that you could use it as a prospecting tool. If you put somebody into our system, you loaded them in, this assessment tool will be a part of their menu so that they could actually do the assessment on themselves as part of our company. And then they can go in and 99.9% of the things they can fix right in our system. I don't know how to make it any easier than that. It's pretty easy. Okay. All right. A lot of talking. Any questions? Come on, Sandra. I know you're thinking of something.
Lance,
It was that good,
you
huh?
do a great job covering it. That's
Well,
why.
I mean, gosh, you guys, it's simple. Now, let's do one last thing. so that you can see one last thing that we offer. Now, I don't want to, I hope I don't come across as a salesman. I don't want to come across as a salesman. I'm a past broker. I know what you folks are going through. But I do want to show you that the HR service has done some smart things here, and we've provided an ERISA solution. I don't know why I got a frog in my throat. We've provided an ERISA solution that you guys just saw. Pretty simple, pretty easy, get those things taken care of. Let's look at what it would look like for the HR side. Let's address the handbook, because we've got some people that have talked about a handbook. You can go in here, or the client can go in here and generate a handbook. So they can list the states that they're in. You know, maybe they're in California, maybe they're in New York, whatever. And you go in here and you check the boxes that you've got employees in. And then it's going to allow you to put in a company statement. Maybe the president has a mission statement or whatever. This is a Word document. So once it's all, you've gone through here, you've generated answered these questions, got it, everything in here, put in the mission statement, so on and so forth. When you come down here to generate it, you would just hit download. Well, there's their handbook. It's completely compliant, because if they mark the state, then we've put in the state information. So New York, New Jersey, whatever, to make sure that everything is compliant. You don't have to do a thing. You're just checking boxes, making sure if you got a problem, if there's something you don't understand, call our rep. They'll help you. Now generate. You can generate this thing as many freaking times as you want. So if you wanted to go in and update it in 6 months because something changed or whatever, you can do it. It's part of this, what we call our HRE solution package. Okay. And everything that you see here is covered in that particular package. Yes, it has a fee. Yes, it's separate from the ERISA, but it's HR related now, and they can do their training videos. You know, in California, there's sexual harassment mandated training. Supervisors have to do 2 hours, employees have to do an hour. I think there's something like this in New York as well. We do it all in here. You can go right into our training videos. There's like 90 of them. And you can set it up so that a supervisor can make sure that their group of employees have these training videos. They've watched them. They're going to get a certificate. They're passed off. Okay. So this is such a valuable tool for that HR director that needs help. They're just slammed. They're loaded. Maybe they're a 50, 60 man group and they have one person and she's got 50 hats on, and you're just trying to make her life better. Well, this is a great way to do it. This is a great way to do it inexpensively. The HRE solution is $25 a month, you guys. That's $300 a year. A handbook, if you called my company on the phone and you talk to somebody else, we start at $1,500 to do the handbook. Oh, we'll do a great job for you. We'll get it all done, but for $1,500. Okay, so for $300, they have the employee handbook, the training videos, any kind of HR form or template that they would ever need for their company is here. And it's a Word document so they can customize it. There's a legal library. If they had a question legally, it's in there. We have a total compensation package statement that they can put together to literally show the exact dollar amounts that people are paying for their benefits, so that it's not just, I just got all these benefits. They don't know what that means. They don't know what it costs. Well, you can show them and they're freaked out like, really? You're paying that much for my health insurance? Holy crap. It's a great eye opener for employees, and it stops them from bitching and moaning about not getting paid enough. Or at least it helps. HR best practices, job description tools, performance management tools, turnover calculators, HR help desk. Let's talk about that for 1 second. Let's say you need Batman. It's serious. You got a real big problem and you need him right now. Okay. We've put this HR help desk in there. It's $40 to make a call to our HR help desk, but they can get, so let's say they got a discrimination lawsuit that might be pending, or they've got a hiring and firing that they have to take care of, and they need some professional advice. Our HR specialists is what we call them. They're HR pros. They'll answer the phone and they will give that person the information that they need to get that taken care of. I hope that makes sense. So it's like having the bat phone, getting that question answered, get Batman on the line, get it taken care of, get out of there, and now you don't worry about it. They probably won't call again for a while. Maybe they have something else that comes up and it's $40 and they can make that call. Okay. So we like to put that in there because we do get occasionally about 20% of the people that buy this stuff will need this service. So we provide it. Okay. So great tool. It does have a separate expense. It's not expensive. If you bought all our e-solutions, so the ERISA and the HR e-solution, you're 240 for one and 300 for the other, $540. And you've got a lot of bases covered here, folks. Okay. So I hope that was simple. I hope that was informative. I hope that you got something out of it. Please don't hesitate to email or call if you have any questions. Jennifer, anything else that you want to add to this? Anything else that I missed, maybe?
Well, the only thing I wanted to touch on, Lance, is as far as for our brokers and agents here, there it is a $600 annual fee, and then they would be able to charge their clients that, 25, $35, or if they wanted to charge 50 and 100, that's also their option too. So, but I just wanted to touch on the annual fee with KAFL.
Right. KAFL just makes it so the broker can be loaded in and now you have access to our services. And that's what that does. And you can load so for an example, let's get out of this. Let's go back into that portal so I can show you how you would load a client in here. If you've got somebody, so here's what I did. I don't know if I told you this, but I always paid for out of my own pocket any group that I had that had 15 or more employees. I felt like it was a good service. I felt like I made enough commission and I could afford the $240. Okay. So let's go into the ERISA solution. Let's go in as a broker. We're going to sign in. We're in the dashboard. I want to load in a client. Maybe it's one of my best clients and I just want to do this for them. This is where you'd put that in. And then here's where you'd go, I want that ERISA e-solution package. Okay. Now, let me clarify what this white glove means. Maybe you have a client that wants us to do the documents for them and they don't want to do it. And you don't want to do it. Or maybe you do. You have that option. We charge them $20 a month if they want us to do their wrap, their pop, and their employee notices. So we would charge them another $240, but we would do the white glove for them and get that done so that they don't have to. If they want to pay that money, great. Okay. So that's what the white glove is, but you guys would pay $20 a month for that service for your client. If your client called us on the phone and they signed up, it'd be $499 a year for the service, where for you it's $240. I hope that makes sense. So if you wanted to charge them $500 or $475, there's some money for you to be made there, and it's a better deal than if they just came and bought it from us. Okay, and dealing through KAFL, that's why you get to do that, because you're they're a GA and you're going through them, so we make it so it's a lot less pricey going through a GA. Okay, Jennifer, did I hit that? Is that?
Nailed it.
Just want to make sure you guys understand. That's why you would want to go through KAFL, because you get a better buy and you can load your clients in. So you would just load them in, and then you go down here and say, hey, is the client or the broker paying for it? You guys can decide. If it's the broker, that you're going to get that price, and then you can bill your client, or you can make an arrangement with your client. I didn't want to do everything for free. If I'm going to do the documents for them, I'm going to charge them. If they want to do the documents themselves, then I'll pay for the service, but they've got to do the documents. And I certainly didn't mind handholding CR England, who has 2,700 truck drivers out there, biggest refrigerated company in the United States. It was my bread and butter account. I made a lot of money off of that company. And I did all this stuff for them because they are, you know, that was the biggest group I've ever had. The commission on that alone was just amazing. So, you know, maybe you've got some of those clients that you want to take care of and you can. You add that client. Once you hit that add client, now they show up in this client list and you have access to their documents. It would show up and you jump in and there you go. Okay. Covered the bases. And we did that all under an hour, Jennifer.
You're getting better each time, Lance.
Oh man, I'm sorry.
They're
I
both
talk
great.
so much.
Thank you so much.
Okay. Guys, it's been great to work with you. Thank you. I hope I answered your questions. If not, make sure you let me know.
Thank you so much. And thanks everybody
Okay.
for joining us. And if you have any questions, please feel free to reach out to us too.
There you go. Have a great day. Thanks, everybody.
All right. Bye, everybody. Thank you.